Welcome. My name is Robert G. Schwartz, M.D. As Executive Director for the South Carolina Society of Physical Medicine and Rehabilitation and President of the American Academy of Ophthalmology, I am pleased to announce our Continuing Medical Education Accredited Symposium, CRPS, RSD, and Thermal Imaging, scheduled for April 30th, 2011 at the Hyatt Regency Hotel in the beautiful city of Greenville, South Carolina, USA. I have been treating patients with CRPS, RSD, with thermal imaging since 1984. I am board certified in physical medicine and rehabilitation, and I'm a fellow in vascular medicine. We utilize a holistic approach to patients with complex chronic pain. I'm extremely pleased that Dr. Marcos Brioski will be one of the speakers at the April 30th, 2011 meeting on CRPS, RSD, and thermal imaging in Greenville, South Carolina. Dr. Brioski is certified in forensic medicine, pain, radiology, and general surgery. Dr. Brioski has started a thermal imaging residency program at the São Paulo Medical School at São Paulo University in Brazil. He is also editor of the Pan American Journal of Ophthalmology. I co-edit that journal and find it an honor to be on the same panel as him in that regard. Complex regional pain syndrome and reflex sympathetic dystrophy represent extremely difficult medical conditions to both diagnose and treat. Thermal imaging objectifies and maps the distribution of vasomotor asymmetry pattern. So what you notice here is an asymmetry pattern, a change in the temperature or the color from side to side, tracking on the inside of the arm and then up into the forearm. And then you'll also notice he has a change in the frontal portion of his face. Each one of these colors represents 1 degree centigrade change. They're supposed to be equal from side to side. So in this area, we have a relative area of coldness. And in this area here, we see more coldness on the outside aspect of his arm going towards the 5th finger, what you'd expect to see in the distribution of the ulnar nerve or thoracic outlet. He also has a heat emission asymmetry pattern here at the base of the omohyoid, where he has a relative cool spot right here. This particular pattern tracks with tightness across the thoracic outlet and explains the cold stripe you see on the ulnar aspect of his arm. Thermal imaging provides the bridge between the patient's symptoms and our objective findings so that we can understand which distribution of sympathetic dysfunction is this generator tracking or coming from. The results are instrumental in formulating a treatment plan and following the response to intervention. Thermography is the study of skin temperature, nothing more and nothing less. When you take a hot glass of water and you put it in a refrigerator, you expect it to equilibrate over time. You don't expect for one half of it to be hot and the other half of it to be cold. Well, we expect the same thing for the human body. If we put it under a cold stress environment, we expect it to equilibrate. When it doesn't, the portion of the nervous system that controls that is dysfunctioning or not working properly. That portion of the nervous system is called the sympathetic system. So thermography not only offers us a very sensitive way of measuring and mapping the distribution of that pain, but by able to determine the actual pathway or distribution that we can measure, we're able to identify the generators of that pain or sympathetic dysfunction. It's my sincere hope and desire that when this conference is completed, that not only the audience and participators in the United States, but around the world will have a better understanding of patients with complex regional pain syndromes and reflex sympathetic dystrophy. They'll understand the importance of thermal imaging and how thermal imaging helps to diagnose and prove exactly what's going on with these people and their conditions. Once you start to objectify the disease, once you start to actually study what's wrong with them, you can treat the root cause of their symptoms and not just try to treat the symptom itself. We are indebted to the sponsorship and assistance of the South Carolina Medical Association. It is because of them that we've been able to achieve 6.5 hours of CME accreditation for this meeting. Special thanks goes to the Bon Secours St. Francis Hospital System in Greenville, South Carolina. Their sponsorship was instrumental in us being able to deliver this program to you. As co-sponsors of this landmark event, the South Carolina Medical Association and the South Carolina Society of Physical Medicine and Rehabilitation are pleased to offer this fully accredited opportunity to learn from internationally recognized authorities on CRPS RSD. We sincerely hope that you will join us in Greenville, South Carolina on April 30th, 2011. Attendance is limited, so please log on to either piedmontpmr.com and use the link for the conference, or go directly to usathermography.com and register today. We look forward to seeing you there.